Okay, welcome everybody to the second webinar by Aberdeen City Council entitled Protecting Our City, Our Duty, the Reopening of the Hospitality Sector Safely. We'll all be breathing a sigh of relief following the announcement yesterday by the First Minister that the city is due to come out of lockdown in terms of hospitality on Wednesday. However, with the lockdown, or coming out of the lockdown, obviously brings an awful lot of responsibility to everyone in the city. 2/3 of us are already on this call from the public sector and the hospitality sector, obviously the third part being the patrons who will attend our premises. So, you know, let's make sure we make the most of this opportunity once we come out of lockdown. Moving on today, we have some housekeeping just to go through before we start. You'll have noticed on the opening slide there that if you want to raise a question, you can do so. Could you please put your email address on it if you raise a question, because on Friday we found we had over 70 questions and we didn't obviously manage to answer them all, and we'd like to be able to give everybody an answer. So if you put your email address on it, we'll certainly make sure we get back to you. Also, could I ask that all the hospitality businesses update their contact details by going to the front of ACC's website page. You click on the box that says update business contacts. That way we can make sure that we have an appropriate contact to get in touch with you to make sure that you're all ready for opening. And finally, at the end of the session, once it's finished, could I ask that any feedback comes to us quickly, because we want to obviously act on it. So thank you very much for that. As I say, we're moving into hopefully reopening on Wednesday. So there's a lot of information that needs to be imparted to you to make sure you're all prepared. We're here to help. We've got a lot of information coming from environmental health, from the police and from NHS. So I hope today will be useful and informative. And as I say, please remember, any questions, pop it in the question and answer session along with your email. I won't continue to withdraw because you're here to listen to the professionals today. So without any more ado, I'll hand over to Richard Sweetman, who's going to speak to you about the grants that have been made available. Richard.
Thanks, Mary. Good afternoon, everyone, and thank you very much for having me on the webinar today. I'm just going to very quickly speak about some of the grants schemes that were announced last week, and just tell you a bit about what they do and perhaps more importantly what they don't do. So I'm going to speak about the scheme, who's included, and then just some reflections that we've had since we heard about it last Wednesday and launched it last Thursday. And I'm very pleased to say we've been inundated with questions about it and challenges around it, as well as people looking to make applications. So in terms of the scheme, the core of it, the Scottish Government announced £1 million of support in response to this local lockdown, and the core of it is £900,000 of grants that are restricted to businesses specified, and I'll come to them, as I say, in a moment. So it's a two-tiered arrangement with a smaller grant of £1,000 for businesses with a rateable value of under £51,000 and a larger grant of £1,500 for those businesses with a rateable value over £51,000. On account of the wider impact that the lockdown was having on businesses that weren't closed but were impacted by the lockdown, a discretionary fund of £100,000 was awarded for the council to allocate to businesses that were impacted but weren't physically closed. And that discretionary element is something that we as officers will be working on with the administration leaders in due course. But the focus has been on the £900,000 in the short term. The criteria that apply, in general, it's a pretty flexible scheme, and we have informed the criteria by what we learned from previous schemes earlier in the COVID crisis. So for this one, there'd be a £10,000 cap on the level of funding available per business, regardless of the number of premises they operate. So the grants I mentioned earlier are related to the business premise, but obviously some businesses will own a number of premises. So you can apply for grants for each premises up to a ceiling of £10,000. Other criteria include business, as you'd expect, having a bank account, and then just important to say that businesses that pay rates through landlords rather than directly to the council, they are also eligible to apply, and that was a constraint in previous schemes as well. And I anticipate that those same broad principles will apply to the discretionary funding when we launch that. So who's included in the scheme? So it is businesses subject to restrictions or closure. And so that is restaurants, pubs, cafes in the main. And there are some exceptions for that in the regulations, but restaurants, pubs and cafes in the main. And essentially, the regulations require the grant will be eligible to those businesses that have been closed to the selling of food and drink for consumption on the premises. And so the grey area is, and one of the reflections we've been having is, well, a restaurant may have closed, but very quickly offered takeaway services. And in that sense, as I speak to you, the Scottish Government interprets that as the business being open. Now, of course, we have argued that the business is shut, it's serving takeaways, and the takeaways in no way compensate for the loss of turnover of a full closure. So we are trying to lift a restriction around that with Scottish Government officials at the moment. And I will keep you updated on that as things develop. But that's where we left it on Friday, and I'm hoping to hear something later today, because that clearly is punishing a lot of the premises in the city that have been forced to shut down. I think it's also worth just concluding and making the point that the Council co-leaders stressed at a meeting with the Cabinet Secretary for Economy, Fiona Hislop, that discretionary element would likely to be oversubscribed for certain businesses. So in other words, if the Scottish Government are saying a restaurant that offers a takeaway service isn't eligible for the £900,000 source, then inevitably they would apply for the discretionary element along with shops and hotels in the city centre, and one can immediately see that demand for that discretionary fund would be considerable and arguably be well in excess of the budget allocated by the Scottish Government. So that's the nature of the schemes. All the information is on the Aberdeen City website. If you go to the COVID-19 page, and there's a business support fund link to that. When businesses click onto that, they'll be, it's something that when I tried to do it just to see everything was working, you will be required to set up a login to submit an application, but that is pretty straightforward. And then finally, if you do have any specific questions about the funding or indeed any other business issues that you would like to raise with me, there's two on the website. There's a business growth team at aberdeencity.gov.uk website, and a number 01224 346 145 if you want to comment on the scheme or indeed get in touch, notwithstanding the questions that you might want to ask me today. So I think that's all I was going to say on the logistics of the fund itself, and I look forward to hearing your questions in due course during this webinar.
Thank you very much, Richard. Thank you. I'm sure everybody's interested to know how they can recoup some of their losses. So, as I say, anybody that's got questions for Richard, if you want to drop them into the Q&A section of the meeting, and we'll get to them at the end. Right, moving on swiftly, we have now Simon Hilton from the NHS who will talk to us about coronavirus. Simon, thank you.
Thanks, Councillor Bolton, and good afternoon, everybody. I'm going to speak to you for the next 10 to 15 minutes, and I'm going to split this into 3 parts. Essentially, the first part is going to be around just explaining some of the terms that you'll have heard in the news and elsewhere around IMTs and health protection teams and test and protect. So a little bit of information about what they are and what they do. The second part, I'm going to tell you a little bit about coronavirus and just set the scene in terms of where have we been at with COVID and where we are now and what we're doing. And then I'm going to bring those 2 things together in the third bit of my presentation to tell you about where we are at specifically in Aberdeen at the moment, and again what we are doing as a health protection team and as an IMT. So the first part of that is around the context of the health protection team, test and protect IMTs. So within NHS Grampian, we have what we call a Directorate of Public Health, so a department of people. And within that department, we have a small number of people called the Health Protection Team, and that's a team that I'm a part of. It was quite small, but it's rapidly increasing in the context of COVID-19. And within the Health Protection Team, we also now have the Test and Protect team. So it's part of the health protection team, but there's an important distinction, which is that Test and Protect has national and local components. So the local component, as I say, is part of the health protection team, but there are also folk who work in the Test and Protect system nationally as well. The aim of the health protection team is basically to protect the public against health hazards, particularly infectious diseases and environmental hazards. And we do this with, we do lots of different things every day to do this. And one of the tools that we have experience of using, but we use less often, is what we call an IMT, which stands for Incident Management Team. And you'll have heard this term, I'm sure, on the news, particularly in relation to our local situation. The IMT is essentially where we convene a group of stakeholders who have particular knowledge and expertise and also can take action. And we call an IMT when we have a particularly significant threat to the health of the public that we're concerned about. So we pull these people together to manage that, to understand it, to manage it, and to put appropriate measures in place to protect the health of the public. And we've got a long history in Grampian of working together very closely with our partners, and particularly in the current context, we're all working very, very closely together. So ourselves in the NHS, local authorities, police, other partners as well as the national agencies. But this is quite a complex scenario, and essentially, almost by definition, really, if you have to call an incident management team to manage a situation, then it means there are no easy answers. So we really work on a basis of assessing risks and trying to work out the most appropriate balance that means we can balance all the various risks and issues going forward. So that's really just to give you a bit of information on what we mean by health protection teams, IMTs, test and protect. So in terms of COVID-19, I just want to take you back a little bit. The first thing I think it's important just to say at the start of this is just to remind people that COVID-19 so this is a type of coronavirus. Coronaviruses are not new, but this is a particular strain of coronavirus. And one of the things that we've been dealing with from the start of the pandemic is that we know a lot less about this particular strain of coronavirus than we do about most infectious diseases that we deal with. And so that has implications, obviously, for how we manage it. And we know less about the virus, how it behaves, less about how and when people are infectious, and also less about the test as well and what it's telling us. So I think it's just really important to keep that in mind, because an IMT always has to make difficult, balanced decisions, but in the context of coronavirus or COVID-19, these become really quite a lot more difficult. So just going back in terms of COVID and where we've come from. So if you cast your mind back, the initial phase of this really was what we call the containment phase. And that's where we don't have coronavirus or this particular coronavirus circulating in the community. And so what we want to try and do is we want to try and identify cases early, and when we identify them, stop them spreading it around. So try and contain the virus and stop it spreading around the community. We know with viruses, respiratory viruses particularly, such as coronavirus and influenza viruses, that containment is really only ever going to last a certain period of time because they spread so rapidly and so easily. The next phase after containment was what we called mitigation. And that's where we know that the virus is in the community, So it is out there, it is spreading, but what we want to try and do is reduce the risks of that and the impacts of it. And so for quite a while now, one of the big focuses of the health protection team has been on care homes, because we know that that's a particularly vulnerable group within the population who have been particularly affected, as you'll have seen, by COVID-19. So one of the things we've been doing is working very hard with them to try and reduce those risks. But obviously that is just one group, and we've been working with all the different areas within the population, but that's been a particular focus. Where we're at now, nationally and locally, is really a mix of those two things almost. So we know the virus is in the community, it's not completely contained, but at the same time we want to try and contain it as much as we can. And so we want to try and identify cases early and stop them spreading it as far as we can, but knowing that we will keep getting cases. And really, it's probably related. I think the easiest way of explaining it is probably relating to the R value that, again, I'm sure you'll have heard about on the news. And the R value is essentially telling you, for every person who becomes infected by this virus, how many people do they pass it on to? And the importance of it is that if one person has it and they pass it on to, on average, only one other person, then the virus will just kind of gradually move throughout the community, and it won't increase and it won't decrease. It'll just gradually spread around. However, if every person who gets the virus then passes it on to two other people, that's this sort of doubling time again that you'll probably have heard people talk about, this doubling effect. And so if that is the case, the R value will be 2, and the virus will start to spread really quite rapidly, because for every person who becomes infected, they will infect 2 more, each of those will infect 2 more, etc. And so what we're really trying to do at the moment is keep the R value down. So if for every person who becomes infected, some of those people will pass it on, but some won't, and the R value becomes less than 1, then the virus will actually start to fizzle out. So clearly some people will pass it on, but some people won't be, and so you're gradually reducing the amount in the community. And that's really what the point of contact tracing and test and protect is. Now, contact tracing is not a new thing. It's our bread and butter, really. And essentially, the test and protect system and test and protect team is an extension of this. And it's really, as I say, trying to contain the virus. It's about when we identify somebody who has the disease or test positive, it's about identifying who they've been in contact with, so that we can take measures with those contacts to try and stop them spreading it. Now, not all of those contacts will have the virus, but if we try and isolate all of them, then the ones who will hopefully not spread it on. We're also testing close contacts as well now in Grampian, and that's really just to try and identify that while we know some people who test positive and some people who are contacts will not necessarily have the virus, again, if we can identify everybody who does and stop them from spreading it, then that's the overall aim. The key messages are still the key messages around this, though, and around controlling the virus are still around social distancing. So very much in the local context, we have found that where people haven't socially distanced, where people have been in close contact for periods of time, the virus does spread between them, and we've certainly seen that. We've seen clusters of people where they haven't been maintaining the distance and the virus has spread between them. So that is absolutely crucial. As I've mentioned, people who develop symptoms should isolate and get a test as soon as possible, because if they have the virus, then obviously we know that sooner, and if they isolate, then they're less likely to pass that on, and we can identify anybody who they've been in close contact with, and essentially try and do what we call break the chain of transmission, stop the virus spreading around between people. So I think that's probably all I wanted to just say about the coronavirus and where we are at the moment and how Test and Protect is trying to control the spread. So the next bit I wanted to talk about really is almost bringing those two things together and just telling you about where we are specifically in relation to the situation in Aberdeen and what we're trying to do to control that as a health protection team and as an IMT. So again, casting your minds back slightly, in late July we became aware of a number of positive cases who seem to have a common link. And as soon as we get that, then that tells us that there might be an outbreak or a cluster whereby there are people spreading it between themselves and spreading it outwards. So an IMT was convened, and the IMT started to look at what the issues might be and to try and understand what was happening, how this was spreading, where it had come from. And what we saw is, as expected, the cases gradually increasing, because from somebody becoming infected to us actually knowing about it, because they have to then develop symptoms and then they have to test positive, there's a time lag. So by the time we know there's an issue, usually there are already a number of people who are infected. So we will always see the cases, or usually see the cases increase. And as we tried to understand the data more and more, it became apparent that all these cases were linked to the hospitality trade within the city centre. And it took a little while to understand that, because of the complexities of coronavirus and the unknowns. That makes interpreting the data to understand it that much more difficult. But we're pretty clear now, as an IMT, having met for a few weeks, that we had a particular outbreak linked to the hospitality trade in Aberdeen city centre. That is now tailing off very much, and that suggests that the lockdown probably has worked. So I know that it's been painful for those of you in the trade, but it would appear to have worked. It's possible to look back and say, well, actually, if we hadn't have had the lockdown, would this have just happened anyway? But the evidence, as I say, that we have, where we have seen spreading between people who haven't maintained a distance, suggests that that the lockdown has worked, and that without that, we would have had a higher risk of spread. Although that particular outbreak is tailing off, we do know, though, that we have a number of cases, and we still have a higher proportion of cases than the Scottish average on an ongoing basis that aren't directly linked to the first outbreak, if you like, to the hospitality trade in the city centre. And so that's one of the things that we've been monitoring really closely. Again, though, that is reducing quite significantly at the moment. So that is really positive news, and that plays into the restrictions and the decision as to when to lift the restrictions. Now, this increased, what we call the increased prevalence, the increased amount of virus in the community, could be to do with a number of things. It's possible that we've uncovered a number of cases who were already out there. We just didn't know about it, and a lot of people came forward to be tested. So it might be that we just uncovered more people because of that. But actually, what we call our test positive rate, so in other words, out of all the people who come and get tested, how many actually come back positive, that was actually and has been higher again than the average. So it suggests that actually it's not just that lots of people are getting tested, a bigger proportion of them are positive. So it would seem that there were more people who were positive and had the infection out there. We have had a small number of hospital admissions, which seem to come slightly later on in the outbreak, and so to me that suggests maybe a little bit of a warning that while we haven't had lots of hospital admissions, they were starting to creep up, and so it's maybe a warning that that if we hadn't have had the lockdown, if we hadn't have taken the appropriate measure and restrictions, that could have got out of control potentially. And that's really about what we're trying to do here. We're trying to control this. We're trying to stop the numbers increasing exponentially, and we're trying to catch that early so that we can do that. So in summary, and I'm almost at the end of the presentation, it looks like we've had an initial outbreak, as I say, related to the hospitality trade in the city centre that is now tailing off. We have had continued community transmission, though, as well, it would appear, but that is also now reducing. It looks like the measures that we took do seem to have worked. And as I say, I think we should consider both the past few weeks and also the number of hospital admissions we've had as a warning, really. The IMT meets daily to review the situation, to review the data, and just decide what we need to do to protect the public every day, just to make sure we're doing the right things, whether there's anything else that we should be doing. And certainly the IMT takes into account what is reasonable and proportionate as well, because we are aware that obviously any restrictions that are imposed also has an impact on people's health and people's well-being as well. So the issues for the IMT really on an ongoing basis are about how we make sure we control the spread of the virus, and also how we can be sure that we are doing that from the data. And again, just to say, there are lots of unknowns around coronavirus which make that bit more difficult, but certainly the picture is improving significantly in Aberdeen and Grampian, and so we appear to be coming to a better place than we have been, and we look forward to things improving. That's all I wanted to say to you this afternoon. Thank you very much for listening, and I will answer questions on the webinar. Thank you.
Okay, thanks very much, Simon. And again, you know, it's a lot of information, but it's really important that we all understand kind of the COVID-19 that we're dealing with, because I think none of us are claiming to be health professionals. We're all finding our way through this, so thanks very much for that. Moving on now to, we have Vicky Stables from Police Scotland.
Good afternoon, everyone. Can you hear me okay? Yeah, all good. Right, thank you, Councillor, for inviting me along today. Just want to introduce myself here. I'm Inspector Vicky Stables. I'm one of the policing inspectors within the City Centre policing team. I must give apologies for Sergeant Jill Flett from our licensing team today. She's been called away to other matters, but hopefully I'll be able to answer any questions on her behalf at the end of the webinar. I'd just like to say thanks to Aberdeen City Council for arranging the webinar, and hopefully we'll be able to put some of these anxieties at ease within the hospitality sector. So Police Scotland, our main priority is to support the public health teams in reducing the spread of the coronavirus. And how do we do that? We do that by assisting and supporting the hospitality sector to comply with the guidance. We'll be there to offer you support if you need us, and also signposting them back to the appropriate service should you need any further guidance, such as public or the environmental health. We realise it's new guidance, and I appreciate that it's all new and quite difficult to understand. It's all new for us as well, and we obviously take time to get our heads around it as well. So we totally appreciate that, especially in the hospitality sector, and I realise the impact it's having on you all as well. And it's going to take a bit of time for us all to get our heads around it and for things to get running smoothly. But if we all start off on the first foot strong together, working together collaboratively, then hopefully that will reduce any instances and any further lockdown further down the line. So in essence, our policing style and tone remains exactly the same as it has been throughout since the start, for both the hospitality sector and your patrons and customers. We will first and foremost engage and explain and encourage any part of the COVID restrictions, and we want to just try and reiterate personal responsibility for your patrons and customers, for them to stay safe. It's not all the onus on the hospitality sector themselves. Everybody has to play their part. And then last and foremost, as a last resort, we would only enforce the guidelines should there be an offence committed there, but that's only, as I say, as a last resort, very much so. So you will see my officers out and about. They'll be doing checks on premises, but that's to keep both you, your staff safe, and as well as the general public, as I've said before. My officers will be there, will be supported by our dedicated licence team, Sergeant Jill Flett, and our colleagues who are fully up to speed with the guidance. And that's really all I really need to say. It's really just to say that we are there for you and we're there to support you as much as we can, and we will be coming in to see your premises, etc. But as I say, it's there to more help you and support you as opposed to anything else. And I just wish you all the best and good luck for your reopening, and I'm looking forward to seeing the city centre vibrant again. And we'll answer any questions at the end.
Okay, thanks very much, Vicky. As you say, the important message is we're in this together, we're coming out of it together, and let's stay out of it together and support each other. We're now moving on to what I would say is the largest part of today's webinar, and that's Alison Robertson from Environmental Health, who's going to give you some crucial, and I underline crucial, information today in helping us come out of lockdown and stay out of lockdown. Alison's put a huge amount of work into this, so I'd like to thank her on record, and the rest of the environmental health team and our partners for making today possible. But you know, Alison has worked day and night to get this right for us. So thank you, Alison. I'll hand over to you now.
Thank you, Councillor Bolton. Good afternoon, everyone, and thank you for attending this webinar. Before I start, just apologies for lumping this all together. We would have liked, if we had more time, to get the webinars split to cafes and restaurants and bars and clubs, etc. But time constraints, it wasn't possible. So just bear with us. There is a lot of information, as Councillor Bolton has just alluded to. So just bear with us, because there's a lot measures here and advice and guidance. Okay, so as you're aware, keeping the spread of COVID-19 under control is an absolute priority for us all in Aberdeen. Coronavirus is still considered a significant threat to our health and remains an international public health emergency. So in readiness and reopening, all reasonable measures must be taken by hospitality premises to ensure risks are kept to a minimum. So to increase hospitality industry compliance with measures to stop the spread of coronavirus and keep the sector safely open, the Scottish Government has published statutory guidance for the hospitality sector. So, next slide, please. So in today's presentation, I'll cover the legal bit, what the requirements are for businesses with regard to the Health Protection Coronavirus Restrictions Scotland Regulations 2020, and I will refer to them as the regulations from there on in. And I'll speak about the requirements of the statutory guidance the Scottish Government's just published in their guidance for the hospitality sector. I'll discuss about the risk, how is COVID-19 spread, how to do a risk assessment for COVID-19, thinking about the hierarchy of control for the measures that you would need to put in to control the risk from COVID-19, and what the mitigation measures would be to control the spread, a bit about enforcement and compliance, and provide you with further guidance and signpost you to templates for risk assessment, other guidance, returning to work safely, cleaning and disinfection, etc., etc. Next slide, please. Okay, so the legal bit. The regulations require that businesses are legally required to take all reasonable measures to ensure physical distancing, to ensure that a distance of at least 2 meters is maintained, or 1 meter in hospitality settings where mitigation measures are in place, between any persons of the premises, except between 2 members of the same household, or a carer and the person assisted by the carer. Sorry, or a person and their carer, that should be. To ensure that they only admit people to the premises in sufficiently small numbers to make it possible to maintain the physical distancing requirements, and that any other measures that are put in place to limit close contact interaction and maintain hygiene. The new requirements also include the collection of customer contact details, which must be retained for 21 days. Next slide, please. Okay, so the new Scottish Government statutory guidance for hospitality premises. So we know that there's a link between hospitality premises, such as pubs and restaurants, and the transmission risk of coronavirus in Aberdeen has shown that. So environments where crowding has been an issue due to poor compliance with physical distancing and/or premises exceeding safe capacity are a particular concern. Therefore, the Scottish Government has deemed it necessary to introduce some new measures and give added emphasis to existing measures to address weaknesses in the current approach, and to keep the risk to an absolute minimum while allowing businesses to remain open. These measures are not designed to add unnecessary restrictions to hospitality experience, nor hold back business operations. However, as I've said, the risk of coronavirus in Aberdeen is very real, and it's a serious risk. It must not be underestimated, and we need to put the measures in place. So many of the measures will already exist in your risk assessment. So we would just ask that businesses review their risk assessment if you've already done your COVID-19 risk assessment to take into account the new measures. So the new statutory guidance health measures are now mandatory collection of customer and visitor contact details to support, test and protect. They're already now in the regulations, so it's a legal requirement for businesses now to collect this information. It was previously voluntary. You're now required to do it by law. Queue management, you're now required to have regard to queue management within your premises and outside your premises, and noise control, looking at background music and TV on mute and subtitles, and controlling noisy behaviour from your customers. Next slide, please. Okay, the guidance, the statutory guidance for the hospitality sector is being issued to complement the existing hospitality guidance available. The existing mitigation measures will still apply, which are physical distancing, 1 metre physical distancing with mitigating measures in place, and that would require your 1 metre zone signage, etc. Increased ventilation, increased hand hygiene, cleaning and disinfection, etc. The Scottish Government are now recommending that table service with no standing of all customers seated, physical distancing, capacity management and no crowding in premises, limits to households mixing indoors and outdoors, and I'll speak about that later. Hand hygiene, as I've mentioned, that includes hand contact surface points, trying to reduce the contact points that people are touching, hand washing and hand sanitising. Hand washing and hand sanitising, physical distancing, etc. are all crucial if we're going to control COVID-19. And that doesn't just mean anybody in food premises, it means everybody. Every person in the whole world needs to be doing this. Cleaning and hygiene arrangements, you need to increase your hygiene and cleaning arrangements for contact surfaces, because that will be the risk where there's spread for indirect contamination risks. You need to manage your toilet facilities. Workforce planning is really important, and it's essential that staff are trained and instructed on all your COVID-19 controls and what to do in certain situations, which I'll come on to later. Next slide, please. Okay, so what do businesses need to do to control the transmission of coronavirus? Well, all businesses you need to undertake a COVID-19 risk assessment to decide and identify the areas that need controls in place and know what the controls in place are required in these areas. So all businesses should undertake a full risk assessment for COVID-19 to help in deciding which actions to take and implement the necessary measures to protect staff, other workers, visitors, pest control contractors, etc., etc., and of course your customers, the public. Before you do your COVID-19 risk assessment, it's handy to know, or essential to know in this case, what the risk is from COVID-19. How does COVID-19 spread, or how does coronavirus spread? So get to know your enemy. And next slide, please. So how is coronavirus spread? Well, I'm sure you're aware that COVID-19 is spread through respiratory droplets produced from the mouth or nose when an infected person coughs, sneezes, speaks, or sings, for example. And there's two ways it can be spread: person-to-person spread and indirect spread from contamination of surfaces. So looking at the person-to-person spread, that's through direct contact or close contact with someone. The current evidence suggests that coronavirus spreads between people through direct contact or close contact with an infected person via the respiratory droplets from the mouth and nose. People who are in close contact within 1 metre within an infected person can catch COVID-19 when infectious droplets get into their mouth, nose or eyes. Next slide. So indirect contact, which is through contaminated objects or surfaces. People with the virus in their noses and throats may leave infected droplets on objects and surfaces when they sneeze, cough on or touch surfaces such as tables, doorknobs, handrails, etc., etc. Other people may become infected by touching these objects or surfaces, then touching their eyes, noses, or mouth before cleaning their hands. Next slide, please. So how do you carry out a COVID-19 risk assessment? I suspect a lot of people probably don't know how to do a risk assessment. I can count on one hand the amount of risk assessments I've had from businesses. So I suspect it's because people are not very clear about how to do a COVID-19 risk assessment. Now, to help you with this, I've included at the end of the presentation some signposting to Health and Safety Executive or the HSE, a template for a COVID-19 risk assessment. There's also a Scottish Government risk assessment tool for COVID-19, and also Working Healthy Lives has also got a COVID-19 risk assessment tool to help you as well. So just running through how you do a COVID-19 risk assessment. So identify what work activity or situations might cause transmission of the virus. Think about who could be at risk, who may be harmed and how. Decide how likely it is that someone be exposed. Act to remove the activity or situation, or if this is not possible, control the risk. And communicate the results of the risk assessment to employees and ensure that the risk assessment is available. But the most important thing is putting the controls in place. There's no point doing a risk assessment, having it all on paper, you know what to do, and you don't do anything else but leave it on a piece of paper. You must implement the measures required. Okay, next slide, please. Okay, once you've done your risk assessment, you'll have a lot of controls that or areas that you think controls are needed. So to help you with this, you should look at the hierarchy of controls. The hierarchy of controls will be familiar to anybody that's done a cost risk assessment, where you look at the hierarchy of controls and PPE are at the bottom of the controls. So unlike some hazards previously, you would like to remove the risk of COVID-19, but it's unlikely to be completely removed by the activity or situation that poses a risk of COVID-19 spread. Therefore, you must consider the control measures required to manage the hazards posed by the virus. If you follow a risk-based approach, focus on the hierarchy control, which seeks to eliminate risks. Combat risks at source, adapt your workplace to individual needs, and ensure adequate staff training to manage the risk. Only use PPE where it's required. This will be explained further in the next slide. Next slide, please. There's a lot of information here, but if you look at the graphic, the most effective is at the top of the inverted triangle and the least effective is at the bottom. So you'll see that PPE is the least effective control. So handing out somebody a pair of gloves is not going to control the risk of COVID-19 spread. We'll come on to the wearing of gloves later. So the hazard COVID-19 cannot be completely removed, as we can no longer all work from home to avoid contact with the virus. Although on this said, you should still be isolating your employees with a higher risk of infection, for example, allowing them to work from home. So people may be asymptomatic and not be aware they have the virus, so COVID-19 could be circulating without our knowledge. As such, elimination of the hazard is not an option in most cases, except for when I say working at home, but we'll all need to get back to work now, so elimination is not going to be a possibility in most occasions. So the most effective control is always to remove or replace the hazard with a safer alternative. As I've said, it's not an option to remove the invisible hazard like COVID-19, but instead you can apply measures that eliminate the risk of transmission through physical distancing. Change the way you work. For example, where you can, don't lay tables, etc. Remove cutlery. If you are using condiments and tables, make sure that you're cleaning them after each customer. Some people don't want to go to sachets, etc. So if you are laying tables, please be aware that these are frequent touch points and you must remove them and clean them afterwards and change them. Introduce app ordering to reduce contact and your staff having to be face-to-face with your customers when they're seated to take orders. Contactless payments instead of handling cash. Think about possibly disposable menus if you don't want to put an app ordering in place. And look at offering a takeaway in or delivery service. As a few businesses have now, a few restaurants are now offering dine at home options, and that can kind of reduce the people coming into your premises, but you're still providing a business to them and you've still got money coming in on that basis. There is information available from Food Standards Scotland for the takeaway sector, and I've signposted that at the end of the presentation as well. So moving on down, engineering measures, modify the workplace to reduce physical contact between people, installing barriers at service counters, for example, or between workstations and tables and seating to enforce physical distancing. Floor markings are a great idea to advise customers, etc., your rules and physical distancing. Separate exits and entrances where you can, redesigning seating, and provision of hand wash and hand drying materials, provision of hand sanitizer at strategic points. When I say strategic points, I mean points in your business where they're needed. One sanitizer behind the bar that's nearly finished and nobody looks at it and nobody uses it, that's not enough. You should have sanitizer points, for example, when somebody comes out the toilet area, because there will be surfaces they're touching after they've washed their hands. So that's important. When people are going into the premises, I would advise our sanitizer there as well. So just think about where you would need the sanitizer and where, after you've washed your hands, you would be touching further surfaces before returning back to your seat. Just think about that, and also have an adequate supply. You don't want to be running short at this stage, so buy in more than you need, and so you don't run out. Okay. Administrative controls. These are your policies and procedures to introduce to ensure workplace safety. They include signage and educating staff about coronavirus risks. Coronavirus-related administrative controls include monitoring staff fitness for work, ensuring that you've got no one at work coming in that have symptoms and they're aware of all that. Workplace cleaning and disinfection procedures. Employee COVID-19 safety training. Look at staggering lunch breaks, start times, shift patterns, etc. to reduce congestion in your staff rooms, staff areas, etc. Placing appropriate signage in the workplace on physical distancing and hand hygiene measures. It's all going to help you and to control the risk. So as I've said, PPE is the last line of defence in safety controls. It includes face coverings, gloves, eye protection, etc. That's often worn for environmental cleaning, etc. And it shouldn't be used as a substitute for any other controls. If you are using face coverings, eye protection, it's included in other mitigating measures. It can't stand alone. PPE is used to minimise exposure to COVID-19, but it must be used correctly to be effective. And as I've said, it needs to be in combination with other controls. Okay, next slide, please. Okay, so what should you put in place? How to follow the statutory guidance? Well, the three things that I've mentioned that you need to do, which are the statutory guidance, is collection of customer contact details queue management and noise management. Now you have to have regard to the statutory guidance. It's not in the regulations. However, if you are failing to comply, we would take into consideration whether you follow the statutory guidance. And if you're not following the statutory guidance, we would expect you to have equivalent controls in place. So to save you having to think about it yourself, just follow the statutory guidance and that's you got the controls in place. That will save you a lot of work thinking about how else you could control the risk. Next slide, please. Okay, we'll just go on to the go through these key areas. So as I've said, it's now mandatory in both the statutory guidance, but it's now also in the regulations. So all hospitality businesses are now legally required to collect customer contact details to support, test and protect. But remember, this is only for service of food and drink on your premises, indoor, outdoor, beer gardens, etc. It's not required for takeaway premises where you're only collecting something and then leaving. Businesses may need to be registered with the Information Commissioner's Office if using an electronic system. So a lot of businesses will probably have this in place already because you've got booking systems now. But if this is a new thing and you're looking to collect data for customer information electronically, you will need to register with the Information Commissioner's Office. You must record the information and keep it securely, and after 21 days, dispose of securely. A privacy notice should be displayed on your premises and website that demonstrates compliance with the GDPR requirements. There is a privacy notice within the statutory guidance for hospitality premises under the tools and resources section. You'll find a lot of posters, information, leaflets, etc. that you can print off for displaying in your premises, and that includes the privacy notice. Next slide, please. Okay, so you must have a robust booking system in place. Question how many separate households are in a booking when you're booking, when customers are making bookings, and advise of booking options available for size of groups. The group sizes are the same as they are for people's households, indoors and outdoors, a maximum of 8 people from up to 3 households, and outdoors maximum of 15 people from up to 5 households. Consider whether you will allow walk-ins. Systems are a more robust booking system, but we realise with small pubs, etc., a booking system is not going to work. So you need to consider how you're going to collect customer details from walk-ins, customers, pubs, etc. Next slide, please. So what is the information you need to collect? So from staff, you need to collect the names, contact number and rota information. For example, which particular day they were on, hours they were on, etc. From customers, the name of each customer if from a separate household or lead member of one household group. So if you've got 2 household groups coming in, say 5 people, 3 from one or 2 from the other, you need to have the household contact for each of the household groups. I'll come on to that later, and if anybody needs that further explained, we can get that explained to you. The date of visit, the arrival time, and where possible the departure time needs to be recorded, but the departure time is not possibly going to be possible to do, but the very least date of visit, arrival time needs to be recorded. Also, if where possible, possibly a table number that your customers were sitting at, or if you've got separate sections, sections where they've been seated. If a customer has no telephone number available, take a postal or email address. Now, some customers may be reluctant to provide you this information, we would ask you to stress why the customer information is needed. It's not going to be used for any other purpose, but to provide to test and protect where the information is requested. Now, the system that you've got in place to collect the information should enable you to provide the information, if requested, within 24 hours to a public health official. And that could be someone from Health Protection Scotland, and equally, it could be from Environmental Health as well. Next slide, please. Okay, so going on to queue management. This is going to be a difficult one for a lot of people. Just how you manage this is going to have to be given a lot of consideration. However, it's now a statutory guidance requirement. So you need to look at queue management, increasing risks that physical distancing will not be observed in queues in a hospitality setting, particularly during the evenings. So think about that in pubs and clubs. Take steps to avoid queues outside the premises as much as possible. Where unavoidable for safety reasons, measures should be taken to ensure physical distancing. There should be no queuing indoors. However, the exception to that is takeaway premises, where you might have somebody waiting to pick up their takeaway. Holding people in line outside premises to wait for others to leave and make space is not a valid reason. If you've got your premises full and you don't know when people are going to leave because you haven't given them a maximum time, then it's not acceptable to hold people in line hoping a table comes up, because all that will happen is people will just start queuing up and up and up, and it'll be stretching up the street. So no holding in line for waiting to a table to become free. However, if you've got a booking and you're just waiting to be seated, then that's different, because you know you're getting in there and you know it's not going to be long until your table's ready. However, we would advise not to turn up to premises too far in advance, because your seat might not be ready and then you will have to queue, which we don't want to happen where possible. Next slide, please. Okay, noise management. Now, this has been a kind of contentious issue. A lot of people have been asking, well, why has my music got to be muted? Why can I not just have low background music? And the reason is that it's difficult to say, well, you can have it up to a certain level here, but no, you can't here, and different premises. For example, outdoor areas, the big gazebos, and you've got a sound system playing. If you've got a lot of customers speaking, you've got music as well, everybody will start shouting and speaking louder over each other, and that is increasing the risk of spread of COVID-19. Now, it may be possible to do this in small premises where there's slight background music. However, the statutory guidance is advising no music on, and TV's muted with subtitles if required. Challenge customers who start to sing or shout. So I want to be going into premises for the foreseeable future. Clear signage to inform customers of expected standards of behaviour, and staff must be fully trained in systems in dealing with difficult situations. You don't want your staff being having conflict in situations with customers where this can be avoided. And if you train them to know how to deal with these situations, it should run smoother and it won't stress your staff so much on having to deal with these difficult situations. Next slide, please. Okay, physical distancing. This is quite difficult for a lot of premises. We know this, so I thought I'll go into a bit more detail on this. So the default position remains at 2 meters. And I should just say that outside premises, if you're queuing to wait to be seated, then you should be remaining 2 meters from the person in front of you. The exception to this is where you've got a person and a carer who can stand together in a queue, and also a person and one other household member can queue together in a queue without physical distancing from each other. However, again, if there's 2 people, the carer and the person, and 2 members of the same household, you need to be 2 meters and 2 meters distance between the person in front of you. Exception for hospitality sector indoors and in your outside areas is you can reduce to 1 meter with additional mitigation measures. So if you've got a takeaway, etc., and you've got everything in place, because you've got a few tables, then the 1 meter can be observed if there's mitigating measures in place. Members of separate households must maintain the appropriate physical distance from each other when seated at tables, and that's 2 meters or 1 meter if you've got the mitigating measures in place. And a system for customers to make orders from their table is preferred. For example, reduce contact by having the menu in an app and providing it to your customers when they book beforehand, so they can think about what they want and then be ready. And that will reduce the close contact that your customers may have when taking orders at tables. Consider your circulation space to allow customers access to their tables, toilets, etc., as this must also permit the appropriate physical distance to be maintained. And it's critically important that everyone observes these limits. Physical distancing, as I've said, hand hygiene, cough etiquette, increased cleaning, these are all key measures for reducing the risk of COVID-19 spread. Next slide, please. Okay, so physical distancing, your capacity management and no crowding. So no crowding, no queuing on the premises, as I said, except for takeaways, if you're waiting for a takeaway. Queuing outside of premises only when deemed necessary, not to hold people in line to wait for others to leave. It's not a valid reason, as I've said. Separate households must maintain 2 meter distancing, and staff should be trained. Actually, I think this is a repeat of my earlier slide, but never mind. It's got a graphic on it, so that'll show you a kind of scenario where the queues should be managed outside the premises with a single household, 2 household party, and 3 household party. That doesn't make sense, a single household party, because I've just said to you previously that it should only be 2 people queuing together. So if there's 4 a single household party, I would advise that at least 2 of you are social distancing, because you'll 4 in a group is going to block pavements, etc. Okay, next slide, please. Okay, 1 meter physical distancing. So this was permitted when the hospitality guidance came out previously, and it was to reduce from 2 meters to 1 meter physical distancing with mitigating measures. Now, the measures are required to be put in place because there's an increased risk when you reduce from 2 meters to 1 meter physical distancing. So what are these measures? Well, the 1 meter zone signage, people must know that they're going into a 1 meter zone. Table service with no standing, all customers seated. Physical distancing, limits to households mixing indoors and outdoors. Increased ventilation, hand hygiene, hand washing and hand sanitizing, cleaning and hygiene arrangements, and also possibly including barriers, etc., to for behind bars to allow bar seating, and the wearing of face coverings by staff who are in front of house serving customers. Next slide, please. Okay, this just gives you an example of some scenarios in your premises for the 1 meter physical distancing. That kind of explains what you could do. Also, just you don't have to have, you can have the space 1 meter, but it's got to be 1 meter distance between person to person. So if your table is only half a meter wide, and then you put your chairs at either side further apart, unless you've got Inspector Gadget arms, you're not going to be able to reach your plate. So people will move their chairs in, and they won't be able to comply with the 1 meter distancing. So bear that in mind. You might need to get wider tables. If you've got 2 narrow tables, you might meet the requirements by putting 2 tables together. Don't just push your chairs back because people will inevitably pull them forward to eat their meals, etc. And then if you're pushing your chairs back, you're encroaching on somebody else's 1 meter space as well. So to avoid the distance between back to back, people possibly think about putting like planters, furniture, etc. in between, where there's a physical barrier rather than that will stop people pushing chairs back, etc. Next slide, please. Okay, as I've said, the 1 meter zone signage is essential, must be displayed at entry points and throughout the premises to inform customers they're within a 1 meter physical distance zone. It's essential to remind everyone to observe requirements to remain at least 1 meter from the next person, with exceptions, which I've said is a person and their carer, and minimise the risk of exposure to coronavirus. Next slide, please. Okay, table service with no seating, all customers seated. All customers should be seated to avoid crowding around bars, televisions, etc. There can be bar seating with 1 meter physical distancing, sort of bar stools. However, remember that going side to side, the bar stools need to be a 1 meter distance from each other going along your bar, and that needs to be managed by your staff. There also needs to be a 1 meter physical distance between your staff member, possibly pulling pints behind the bar and serving drinks, to the customer sitting on the bar seat at the other side of the bar. Now, when you're pulling pints, it's probably not going to be able to do the 1 meter physical distance. Probably won't be possible. Therefore, perspex screening could be a way to barrier between your staff member and the customer sitting on the bar stool. If you haven't got barriers in place at bars, then we would advise that your staff wear a face covering, and to observe, and also to observe the 1 meter physical distance. Now, if you're also thinking about putting in bar seating, think about not only the physical distance between you and the bar staff member, but also people behind you that may need to pass by to go to toilets, etc. There needs to be a space of 1 meter between people sitting at the bar and people going to the toilets, passing them by. If this isn't going to work, then I'm afraid you're going to have to take your bar seating out, because people moving about is more important, or moving to the toilet freely within the 1 meter distance, or following the 1 meter distance rule is more important than people sitting at the bar on stools. As I've said, no standing at the bar. People are not allowed to stand next to each other, crowding around bars and TVs, etc. So it can become crowded spaces, and it makes physical distancing difficult, must be avoided. So physical distance easier to achieve at pre-arranged seating areas, but it's not possible in all occasions. So just think about how you're going to do that if you've got walk-ins, etc. What you want to try and do with walk-in customers is have most of the problems solved at the front door. Once they're in a premises, it's more difficult to get somebody out if they're not going to physical distance, etc., not follow the rules, not going to provide you with contact details, etc. So just think about that. Get a lot of your controls in place, signage, etc., at the front door, also in your website, etc., so people can know what they're going into in the premises, know what your rules are, and how you're going to achieve your no standing. Next slide, please. Okay, businesses are reminded that capacity should be determined by the need for physical distancing, and numbers must not exceed safe limits. So systems should be in place to safely manage capacity to avoid overcrowding. It's essential that crowding in general is not permitted, and it's an identified risk and must always be avoided. So think carefully in your risk assessment how you're going to manage this. Speak to your staff. Your staff will know about a lot of the pinch points, and they'll have a lot of good ideas, I'm sure, of how to manage this side of things. It's a legal requirement also to consult your staff on the risk assessment. I should have mentioned that earlier. So please be advised that you should, or you're required to consult staff on the risk assessment. Businesses should challenge any occurrences of crowding and remind customers of their duty of care to the business and each other by observing physical distancing if crowds start to form. For example, if you've got a game on the TV, you've got your TV muted, you may get some people congregating round and not social distancing. That's an issue that needs to be managed by the premises. Okay, next slide, please. So managing capacity. Appropriate physical distances must be maintained between all individuals throughout the premises, not just between seated parties. To ensure that you only admit people to the premises in sufficiently small numbers to make it possible to maintain that distance. And that is a legal requirement. It's in the regulations, so you're legally required to make sure that that is happening. And we will be asking businesses, how are you going to manage that? And we'll be looking for you to demonstrate your system in place by kind of talking us through it in the premises when we visit. All of this must be taken into consideration when determining your maximum capacity, and really important to think about how much toilet provision you need, especially in licensed premises. For example, if you add a massive outdoor area and you've got, it increases your capacity overall, although I know possibly inside premises there'll be less capacity. However, if you're increasing your capacity overall, then you'll need more sanitary facilities. The Building Standards Scotland requires every building must be designed in such a way that sanitary facilities are provided for all occupants of and visitors to the building in a form that allows convenience of use and that there is no threat to the health and safety of the occupants or visitors. The Technical Handbook for Building Standards in Scotland has a section about sanitary facilities in non-domestic dwellings. That will give you a guide to what's needed in your larger premises. This might not be an issue in smaller premises, but you may have to think about it if you're having to take any toilets out of use where you've got not full part-height partitions and the extra ventilation is being shared between two cubicles. So think about how your toilet provision is there, and if you've got a big outside area, you may have to think about putting in more portable toilets. And again, the physical distancing must be managed for people visiting toilets inside the premises, because they are going to be pinch points, and you don't want massive queues for people going to the toilet if you haven't got enough toilet space. And it may be an issue, as I say, with larger premises, not probably an issue in your smaller restaurants and cafes, but it's something to bear in mind that you must have adequate facilities. However, if you are lowering your capacity, as a lot of businesses only operate in maybe 30–40% capacity, you should have adequate facilities, but just bear that in mind if you're having to take any of them out of use, as I've just said. Okay, next slide, please. Okay, limits to households mixing indoors and outdoors. I know it's a contentious issue, and a lot of people are saying, well, how's that going to work in practice? Unfortunately, don't shoot the messenger. I didn't make up the regulations. We've got to just enforce them, and we have to guide and assist you as well, but it's really up to the business how you do that. I'm just clarifying strict limits on the number of households can meet up to one time, 8 people from up to 3 households indoors, and 15 people from up to 5 households outdoors. It applies to hospitality premises as it does to your own home and meeting people in your garden, etc. You need to maintain physical distancing between households in a mixed group. And I know it's going to be difficult. How do you get a 1 metre social distance if you've got possibly 3 households indoors? Sometimes I don't know how you're going to do that in some premises, but the businesses need to look at that and be able to apply it. That's the areas we are finding difficulties in when we visit premises. So have a think about how you're going to do it. Some people are saying, well, that's not going to happen because I've got really small tables. Well, my answer to that is get bigger tables. Or just don't have households mixing. It's really up to yourself how you do it, but it must be managed. Businesses should challenge people making bookings to ensure the 8 to 15 rule is not exceeded. If you are remember, you'll need to have the contact details from each household, a member of each household. So if you've got 3 different households indoors or up to 5 households outdoors, you need details from each of that household. And that will give you an idea of people mixing at tables for different households. There's still a need to maintain physical distancing and be prepared for customers being argumentative about these limits, have a system in place to deal with this, and staff should be trained in what to do in this situation, and all relevant communication clearly communicated to all concerned. If you've got a lot of customers arguing about this, do you really want them in your premises anyway? So just have a think about this. I know everybody's trying to get back on track, and businesses have been closed for so long, but this is a key factor in maintaining your physical distancing and reducing the spread of coronavirus in Aberdeen and beyond. Next slide, please. Okay, so this is just giving you a graphic about physical distancing. For example, if you've got 1 household with 8 people, they don't need to physically distance in the 1 household. But 2 households, there needs to be a 1 metre between the 2 households, and minimum distancing within a party of 3 households, 1 metre between each person. So have a think about how you're going to do that and work it out. You might want to get some of your staff into the premises to just work out how you're going to manage that in practice, but it must be managed. Next slide, please. Okay, one of the mitigating measures is increased ventilation, and that's a key measure. You should have doors and windows opened where possible. Now, I realise it's coming into worse weather for us, or any day can be bad in Aberdeen, as we know. So think about that as well, but you must have increased ventilation if you're to put the 1 metre mitigation measure in place. And if you've got air conditioning units, think about the direction of the airflow. Should be pointing away and not down over tables. There has been cases in Wuhan, China, in Germany. It's been linked to poor ventilation with the air conditioning units, the flow of air pointing down towards the tables and spreading the risk of the virus. So think about that. If you can move the direction of airflow, look at that. You need to think about the number of air changes to ensure you're getting proper fresh air circulation in your premises. So if you can, look at that and possibly adjust it where necessary. Get your air conditioning checked before the opening if it's possible. Your air conditioning or your ventilation contractor will be able to advise you what you can and can't do to your system to improve ventilation. You might be able to adjust the fan speed, for example, and make sure that your ventilation system is on, and this includes kitchens and your customer areas. The amount of times I've been into premises and the switch on the ventilation as soon as I turn up, it's not acceptable. The ventilation system is there for a purpose. It needs to be there under health and safety to allow a fresh air change for your staff, and also adequate ventilation is needed for customers. And also, in addition, with the risk of coronavirus, it's essential that there's adequate ventilation in premises. So just think about that. Try and keep doors wedged open where you can, but remember about fire doors, you'll need to keep these closed. Okay, next slide, please. Okay, hand hygiene. As I said earlier, hand hygiene, hand contact surfaces, hand washing and hand sanitizing, reducing hand contact surfaces rather, are key measures for reducing the risk of spread of coronavirus. So, as I've mentioned previously, encourage the use of contactless or cashless payments where possible. Consider other ways to reduce communal hand contact surfaces. Use signage, display screen messages. You might have a TV or like a TV screen or computer screen just with continual loops of messages to your customers, and use any other relevant communication tools to remind customers to maintain hygiene standards, hand washing and coughing etiquette. Encourage customers to observe high standards of hand hygiene, providing hand sanitizer at entry and exit points and in common areas such as outside toilets, etc. Now, self-service buffet type services for food and drink can carry a high risk due to the sharing of utensils, serving spoons, tongs, etc., and multiple people possibly congregating around the buffet sections. So I'm afraid you shouldn't be offering this service at this time. Now, it's been asked in the webinar already, can you advise if sharing platters are permitted for different households that's attending a bar? The answer to that is no, because if you've got different households touching different food, there's a risk of contamination. So no, we would advise that is not the case at the moment. And if you are having platters, give one to each household, or give one to a smaller platter to each person. Okay, consider options for pre-packed goods for over-counter sale rather than having open foods there. And think about if you've got like a display counter and you're maybe making up sandwiches, etc. You're possibly going to have people pointing to the sandwich fillings, etc. that people want, and that is a high contact touch point that you're going to have to manage and clean and disinfect excuse me, after each customer. So think about that. Can you still provide that service safely? If not, think about an alternative way of producing your sandwiches, etc. Next slide, please. Okay, cleaning and hygiene arrangements. You must have robust cleaning regimes for all shared and hand contact areas, including toilets, toilet door handles, toilet doors, the push plates in toilets, tables, glasses, condiments, etc. On tables, chairs, etc. One way to do this and identify where you're going is which areas need to be cleaned is go around your premises, walk around your premises, get a load of little sticky notes and stick a little sticky note on each surface that you touch, and then get somebody behind you to go round and note them and take them off, obviously. And that'll give you a real good insight as to which contact surfaces need to be cleaned. If you're doing that, obviously remember to clean all the surfaces afterwards if you've just touched them. But it does give you a good indicator of where the common touch points are. You may want to put kind of signage up to say common touch points, just to identify to cleaners, etc., where they should be cleaning regularly. And think about not just your customer areas, but also your cleaning work areas, staff rooms, canteens, and equipment that needs to be cleaned frequently. Adequate hand washing facilities should be required. It should be there for all staff and customers. We don't want to go into any of your kitchens and toilets and find that there's no soap there, or no water supply, inadequate water supply for washing hands. Make sure that you've got adequate supply of hot and cold water and soap, liquid soap preferably, and hand sanitizer outside the toilets as well. Clean your work areas, etc., as I've said, and you should produce a cleaning schedule and train your staff in it. You should also, where possible, have your cleaning schedule available for staff to refer to as and when needed. Don't have it on your computer that they can't access it, or in a folder in the manager's office that nobody looks at. This is a live document. People need to know what to clean, when to clean it, and how to clean it properly, and who's got to clean it. Having a cleaning checklist may be a good idea, having it displayed in toilet areas, etc., because that will give confidence to customers that you're taking the risk of hygiene control seriously for coronavirus, and that you're cleaning these areas regularly. Also consider whether you can provide additional waste facilities and more frequent rubbish collection, because you will have an increase in the amount of disposable paper towels, etc., that people will be disposing of, possibly used tissues, etc., and think about your rubbish collection. Also, we would advise you not to have like swing lids in your bins in any areas, because they're an additional contact contamination point. Same goes in your kind of kitchen. We'll always go on about this. It's a cross-contamination point having a swing bin in your kitchen, because if you touch it when you're disposing of your paper towels, you're just going to have to go and wash your hands again. So it's a vicious circle. Okay, next slide, please. Okay, adequate controls, management of toilet facilities. This is really key, because everybody in your premises will be using the toilet facilities at one time or another. So enhanced cleaning of your toilet areas is necessary. Think about the equipment in your toilets. If there's any additional equipment that's there for cosmetic purposes, just to make your toilets look good, these are things that need to be cleaned as well, and also reduce the space for people getting into the toilet. So try and remove these as where possible. Communicate to your customers how you would want them to use the toilets. For example, what I've seen is a really good one is that putting a latch on your door to your entrance to the toilets. This can work in smaller businesses. It won't work in large premises. But that gives you a kind of one in, one out system, and have a in-out slidey sign thing on the door. They're very inexpensive, I'm told, easy to get, and a really efficient way to do it. but remember about cleaning these things as well, because they'll be touched every time somebody comes in and out the toilet. Hand hygiene in toilet areas, as I've said, and physical distancing in toilet areas. Toilet areas are going to be small areas normally. You don't have a lot of room to be queuing, to think about how that's going to be managed. As I say, you might need more toilets, portable toilets outside your premises if you've got a large outside area. One tip that I was given about getting people through your toilets quickly is to cover up the mirrors. You don't have to have mirrors in toilets, although we would advise to keep it in a disabled toilet. But you don't want people congregating in toilets for any length of time, so cover up the mirrors will get them out the toilets quicker. Next slide, please. Okay, a bit about personal protective equipment. I spoke about that previously, about the hierarchy of controls. I'll speak now about the face coverings and the use of disposable gloves. Next slide, please. Okay, face coverings are not required in hospitality premises. They're not a legal requirement as they are in shops. However, we would advise that when physical distancing, standing 1 metre away or more away is not possible, for example, front of house staff serving customers, wearing a fabric mask is an important measure to protect others. Risk assess this for the front of house staff. Requirement for a barrier to control the droplet spread may be more effective than somebody wearing a face covering behind a barrier at a bar. But at table service, it's probably not going to be possible. It's possible also in premises like takeaway premises with seating, or small cafes where you've got a takeaway element on seating. You might want to have perspex screens behind the counter to observe the 2 metre distance. Regarding outside, no evidence to suggest a benefit outdoors from wearing a face covering unless in a crowded situation. And just going back to the wearing of face coverings, if you've risk assessed it and your staff do want to wear a face covering, or you feel it's needed, then a face covering is needed and not a visor itself. A visor or shield is not effective because there's a risk of spread, because your mouth and nose are not effectively covered, or your nose is, but not effective as it is with a face covering. So remember, if you've got a face covering, you want to wear a visor together, that's fine, but no visor just itself. You can't have a face covering itself. Next slide, please. Okay, so this is just a bit about how to wear a face covering properly. The World Health Organization also has a really good video clip about this. So I would advise you to watch that and adhere to the guidance. Next slide, please. Okay, use of disposable gloves. This is a big bugbear of mine in premises. If I go into premises and I see somebody with gloves on that's serving at a till, I'll be asking them how often they change their gloves, how much pairs of gloves do you use in a kind of day shift or whatever. In reality, if you've got disposable gloves on, they need to be changed as many times as you would be washing your hands. They're not a preventative measure for as a substitute for hand washing. You may want to wear them if you've got dermatitis, for example, but the use of gloves in the community may lead to the misconception that hand washing practices can be neglected, and that is not the case. There's currently insufficient evidence to recommend the regular use of gloves as a preventative measure in the context of COVID-19 to the public and to people in most occupations. If you weren't wearing them before, don't start now, because we are encouraging hand washing and hand sanitizing. If you are wearing gloves and you handle money, then you need to go and you need to go and change your gloves after each transaction. So instead of that, go and wash your hands, or have another method of rather than hand-to-hand contact with money, of another method in place, for example, contactless payments. Next slide, please. Okay, key considerations for your workforce. I kind of went on a bit this earlier, I think. Think about shift patterns, staggering start and stop times. So rather than starting at 9 o'clock in the morning, all your staff, you might want to have staff at 9, maybe others at 10 past 9, 20 past, etc. Just to give people a bit of time to get changed, etc., to avoid congestion in staff changing areas. Again, staggering break times to avoid congestion in staff restrooms. Think about how your staff are travelling to work, trying to get them to avoid car sharing, where social distancing between different households is very difficult. If you're on public transport coming into your work, remember about your face coverings, and very important to ensure that staff are fit to work. Nobody should be coming into work when they're unfit with COVID-19 or any other illness that can be spread to others. And remember this, and staff should be trained to know not to travel into work if they start to develop symptoms. And this leads me on to staff training and instruction, which is key to the whole thing. Every member of staff needs to be trained and instructed. And the requirements within the food hygiene regulations regarding training has not changed. And as part of your health and safety requirements, you're also required to train your staff effectively as well. Okay, next slide, please. Okay, staff training and instruction, as I've said, it's essential prior to on another return to work to train your staff. It should cover new enhanced hygiene and physical distancing measures, and it can help demonstrate that you're taking the risk of COVID-19 seriously and have adapted your work environment accordingly. This should have the effect of increasing confidence among your workforce, sending the message that the workforce is safe, while also being clear on individual employees' responsibilities. Remember to include things about like what to do about queuing and how to deal with that kind of situations, and challenging customers, or customers being challenging behaviour regarding mixing of households, etc. Next slide, please. Okay, staff fitness to work. It's important that nobody with COVID-19 comes into work. You should stay away from work, self-isolate for 10 days and get tested. People who are required to self-isolate should not attend work, including individuals who have developed COVID-19 symptoms or been diagnosed with COVID-19, whether they have symptoms or not. We should follow self-isolating guidance on the NHS Inform and Test Protect website. Individuals, if you don't have the website, phone NHS Inform, Test and Protect, and they will provide you with the information. Individuals from the same household as someone who has symptoms of COVID-19 or who has been diagnosed with COVID-19, whether they're symptomatic or not, should be self-isolating and following the guidance on NHS Inform and Test and Protect. Household member includes those sharing households with multiple occupants and those living in accommodation with shared bathrooms and or kitchen and living facilities. On Friday's webinar, we were asked about houses in multiple occupation. A lot of students are coming back to Aberdeen. They may be sharing a big house as an HMO. They'll be sharing the kitchen and possibly living room and bathroom facilities. They won't be one household until they've been with each other, all in the same household for at least 10 days. So in the first 10 days, they are different households. After that time, if they're all symptom-free, they can be one household for going out and about. But remember that inside premises, you can only have up to 8 people, although you can have up to 15 outdoors in one household. One group rather, individuals who have been identified as a contact of someone with COVID-19 should follow self-isolation guidance on NHS Inform and Test and Protect, and see NHS Inform for further information. Next slide, please. So what do you do if someone becomes unwell with symptoms of COVID-19 on your premises? Make sure that all staff and individuals in your workplace, including children and young people, know to inform a member of staff or responsible person if you feel unwell while on your premises. If the affected person has mild symptoms, they should go home as soon as possible and follow the guidance for households with possible coronavirus infection, self-isolate, get tested, phone NHS Inform to get tested, and follow the rules. If they are so unwell that they require an ambulance, phone 999 and let the call handler know you're concerned about COVID-19. And if you have a spare room, a separate room available on your premises, isolate them away from your other customers until an ambulance arrives or someone comes to collect them. And once the person leaves, clean and disinfect contact surfaces and be extra vigilant on staff fitness to work. You should tell your staff that there has been somebody with symptoms in your premises, to be extra vigilant about their symptoms if they develop them, not to come into work. And also anybody involved in the cleaning and disinfection, advise them about the contact that's been in, and the person that's been in rather, and also advising your staff about take care about hand contact surfaces and washing and sanitising your hands after touching surfaces. Ensure that customer contact details are available, readily available in case requested by a public health official. And as I said earlier, this information should be available on request within 24 hours. Okay, next slide, please. Okay, contact with a case of COVID-19. Everyone should follow guidance for contact of cases of COVID-19 when advised to do so. Individuals identified as a contact of a case of COVID-19 should follow the guidance on self-isolation. See Scottish Government's collection and guidance on Test and Protect and NHS Inform for further information. I'm sure Simon may be able to fill in the blanks on this at the end of the webinar if I hadn't covered it. Asymptomatic individuals living in the same household as someone with symptoms or a confirmed case of COVID-19 should follow household isolation and stay at home and take advice from NHS Inform. Next slide, please. So cleaning and disinfection following a case, as I've said, I think this is a repeat of my earlier slide. There's a bit more information on it. Once a possible case has left the premises, the immediate area occupied by the individual should be cleaned with a detergent to remove organic material, then a disinfectant to kill viruses. Any disinfectant you use to kill viruses should comply with BS-EN 14476. Also, household bleach mixed to the right dilution rate is also effective in killing viruses such as coronavirus. Just ensure that you're using it properly and don't use it on any food contact surfaces. And an alternative could be Milton sterilising solution that's used for babies' bottles. That would also kill coronavirus, but remember to ensure that you're using it at the correct dilution rate and for the correct length of contact time. Don't leave it on and wipe it off after 30 seconds if the manufacturer's instructions say leave it on for 5 minutes. Just beware and make sure that you know what the contact time is and what the dilution rate is to be effective against coronavirus. So, as I said, include any potentially contaminated high contact areas such as door handles, etc. And once this process is completed, the area can be put back into use. You should undertake environmental cleaning with disposable cloths, disposable paper towels, etc. And if following a case, cleaning following a case, these disposable cloths, mop heads, etc. should be disposed of, put into a waste bin, double bagged, and put out into your general waste. Again, training on the correct use of the cleaning and disinfection cleaning chemicals is essential. How to dilute them, how to apply them, and the contact times, etc. Next slide, please. Okay, guidance for customers and communication. You're going to have all these controls in place, and it could fall down at the first hurdle if you don't provide guidance to your staff, or customers, on the expected behaviours. So if you can, have signage up in your premises. Also, where you can, use as much means of communication as possible, websites, when people phone to make orders, social media, etc. You should spend the same amount of time giving your putting the information on social media about safety messages than you do with telling your customers that you're reopening up. So we expect to see some display notices in your premises about this, or to be able to demonstrate how you've got that guidance across to customers. Customers have a strong role to play in ensuring that businesses are able to provide the public with a service by also protecting their employees and customers. Other customers. Successful return to an ongoing operation of businesses will be highly dependent on positive customers' behaviour, and they're the first line of defence against coronavirus. Scottish governments have published tourism and hospitality customer guidance, and also include some signage, posters, etc. on their tools and resources in that guidance that you can print off and display in your premises. The message to customers should be crystal clear. They should know what's expected of them. No loud and rowdy behaviour, no crowding, queuing, etc., etc. This will help to ensure that you can remain open for business. Next slide, please. Okay, the guidance for business preparing foods. Just on this, the Food Standards Scotland has designed COVID-19 guidance, and that supplements general guidance for consumers and food businesses. There also is guidance for the takeaway business sector, or businesses that may not have had a takeaway collection delivery service previously. So I would advise you to have a look at that, and I've signposted that in the guidance at the end of the presentation. Hospitality businesses with queries or concerns regarding food safety practices on their premises should contact us here in Environmental Health Advice. And although we can't do everything for you, we can guide and assist you where we can. Okay, next slide, please. Okay, just coming on to your compliance and enforcement. This is quite important, and I didn't want to start with this, but we're coming towards the end, you'll be glad to know. So it's important that you know the compliance and enforcement approach that we're taking. So to date, we've been following the 4E approach, which is to engage, educate, encourage and enforce. And our aim is to continue with this. And you should know that we are here to guide and assist businesses where we can. You'll know that the Scottish Government published yesterday in their guidance that you'll be contacted by Environmental Health by way of visit. Not all businesses will be contacted by way of visit. A lot of businesses will be by way of telephone call. We have a lot of local authorities in Scotland helping us out. So you may be contacted, especially smaller premises, smaller cafes, etc. It may be a colleague from another local authority, and they'll ask you a series of questions and go through a questionnaire with you regarding COVID-19 controls. we would ask you to provide all of that information and be honest about what's in place. If you're not sure about it, let us know what controls are in place. If we are advised in a questionnaire that the controls are in place and we come and visit your premises, we expect to see the measures in place and being able to work in practice. Don't try and bluff us by telling us stuff that isn't there, because we will be visiting your premises at some point and we'll find out. And also, it's putting your customers and your staff at more risk if you don't put in these controls. So our aim is to continue our approach to engage, educate, encourage and enforce, but we will no longer tolerate continued COVID-19 non-compliance by businesses, and we will use our enforcement powers to secure compliance moving forward. So as I've said, officers will be visiting hospitality businesses and will take immediate action if it's required to do so to control the risk of coronavirus to public health in Aberdeen. I should just say as well, their businesses do not have to wait for environmental health to visit them before they open. We will have businesses that we're working with that have a lot more work to do, and those businesses will know because we'll advise them not to open. So we will be visiting your premises. We have to work together on this, and we're all required to do our bit to beat this virus in Aberdeen. Next slide, please. So if you don't get it right and we have to take enforcement powers, what enforcement powers can we use? Well, we can issue prohibition notices to the business under the COVID regulations. However, if we do that, they remain in place for the duration of the regulations. So alternatively, we would look at serving you a prohibition notice under the Health and Safety at Work Act. You've got a requirement under the Health and Safety at Work Act to protect the health and safety of your staff and others affected by your work activity, customers, visitors, etc. So we can serve prohibition notices under that regulation, or under that act. We can report you to the Procurator Fiscal and bypass the notices if we think it's serious enough to consider prosecution. We can object to your occasional licences for the outdoor areas through spaces for people. We can and then we can recommend permissions to use, object to your occasional licences through the licensing board and recommend permissions to use public spaces are revoked through spaces on people. And we can investigate and instigate a public health review of your premises alcohol licence through the licensing board. To check whether you're a fit and proper person to hold a licence if you can't comply with the requirements that's put in place for COVID-19 and the statutory guidance measures. Next slide, please. So there is additional COVID-19 control measures under consideration, and this will empower local authorities to take action to deal with poor compliance. This would be probably by the service of notices, which are similar to the remedial action notices that we use under food law, and this could close your non-compliant premises or impose conditions on premises remaining open for the purposes of preventing, protecting against, controlling the spread of infection. The measures are vital and they're a proportionate step to be taken for non-complying businesses. We will help ensure businesses stick to the rules and ensure immediate action is taken where COVID regs and statutory guidance are breached, but we won't continue to accept businesses that continually non-comply with the requirements and still pose a risk to customers and also posing a risk really to the operation of businesses right across Aberdeen. We do not want to return to the lockdown that we're just coming out of in the future. Next slide, please. Okay, under additional public health measures are under consideration. Scottish Government will continue to explore further options to avoid risky behaviour and practices. which risk further transmission of coronavirus. And these include a limit of number of bars a customer can visit a day. I don't know how that's going to be enforced unless you electronically tag everybody. So I'm not sure how that could be done. Entry cut-off points, setting a terminal closing time for the premises. There's no entry after that time. So it could be that it's earlier closing to get people out your premises quicker, not opening too early in the day, etc., etc. Okay, next slide, please. Okay, so you may have other key considerations for your business that will change due to COVID-19 control measures being put in. For example, fire safety. Are you blocking off any exits to your premises? If so, is there still safe means of escape throughout? To get out of your premises safely, think about that. Your security, is access to your premises still secure? Could customers sneak into and out of your premises by unmanned open entrances or exit doors? Is more stewards needed at entrances and exit points? One thing also is to think about is people going outside to use smoking areas and congregating in smoking areas where no social distancing is will be adhered to. That needs to be managed. So think about that. Also, your food safety management systems, if you're increasing your cleaning, for example, you're using different cleaning chemicals, you've got more training in place for COVID-19, you'll need to update your food safety management system and your HACCP-based systems, and we will be asking these kind of questions when we visit your premises. And that is for food service areas as well as cafes and restaurants, etc. Has the rules for your staff personal hygiene changed? If so, update your health and safety requirements, existing risk assessments on your food safety management system as well. And how are you incorporating staff fitness to work policies into your existing procedures? Just think about these and consider how it's going to impact across the premises with other of your business needs and requirements. Next slide, please. Okay, just a few notes for your diary. University Freshers Week is coming up in September for both Aberdeen and Robert Gordon's universities. Although there's a lot of the courses now online, and there might not be as much students coming into the city to study face-to-face classroom contact, there will be university students within your premises probably during the university's Freshers Week, although it may be more low-key than normal. However, just bear in mind that the Aberdeen September holiday weekend is on the Friday the 25th and Monday the 28th of September. And the Sunday of that, the Sunday the 27th, coincides with the end of the Aberdeen University Freshers Week. So, as you'll be aware, in Aberdeen September holiday weekend, a lot of people go out to enjoy their last kind of holiday before Christmas time. Especially on the Saturday and Sunday, so just be aware of that, because you could have a lot of crowds gathering or potential for crowds gathering during that weekend. So just bear that in mind and try and plan it into your plans for reopening, because it's only a few weeks away. Next slide, please. Okay, I'll just quickly go through. I've got some further guidance and sources of advice for you on the. So here's the Scottish Government guidance for the hospitality sector. Next slide, please. Some stuff on risk assessment from the Health and Safety Executive, Scottish Government, and Healthy Working Life. They'll all help you on these links. The information will help you to do your risk assessment. But also we're here to guide and assist you with anything you're not sure about in your risk assessment. But we can't do it for you We can only guide and assist you. Okay, next slide, please. Some information about making your premises COVID secure from the Health and Safety Executive, Scottish Government staying safe and protecting others. Food Standards Scotland, I mentioned, about guidance for food business operators and employees, and guidance for the takeaway sector. Next slide, please. Returning to work safely for the Scottish Government, and the hospitality guidance for the Scottish Government also provides an operational checklist which can be printed off and for you to check. And Food and Drink Scotland also have a coronavirus information hub which will help with a lot of that information. Next slide, please. So staff training and instruction, HSE have got a really good guidance on talking about your workers, about preventing, talking to your workers, not talking about your workers, sorry, and cleaning your workplace as well. Health and Safety Executive and Health Protection Scotland have both got guidance about cleaning your workplace. And the Health Protection Scotland guidance on COVID-19 for non-healthcare settings is a really good guidance tool anyway. Next slide, please. Okay, so just in summary, take steps to comply, implement control measures and follow the guidance. Focus on ensuring you have measures in place to control physical distancing, your queue management, noise control, enhanced cleaning regime, hand washing and hand sanitizing, staff training and instruction. Remember that your collection of visitor details and staff details and customer details are now a legal requirement, so you must have that in place. If you're following the 1 metre mitigating measures rules, then you have increased ventilation, signage, barriers should be considered, face coverings, etc. Combined with the collecting customer contact details. And also, as I've said, it's very important to communicate your key COVID-19 control measures to your customers so they're clear about what's expected of them. And as Nicola Sturgeon, our First Minister, says every day, follow the facts, and most of them all, everyone stay safe. Next slide, please. Okay, so on a positive note, because I know this has kind of probably sounded a bit like a lecture, just to say that the majority of premises have already gone above and beyond and have not much to do to comply with these statutory requirements and the guidance that's already there. The hospitality sector guidance will help you to ensure these premises that have fallen short no longer do so. But remember, the guidance has been out for months. So, I mean, it's not going to be acceptable for us to come into your premises and say, oh, I didn't know what to do. Too late, you should have got this done ages ago, and not waited for the last minute to say we don't know what to do. We can't guide and assist you, we can't do it for you, and we would expect you to have done a lot of the work before now. Scottish Government hospitality guidance are not designed to add unnecessary restrictions to the hospitality experience, nor to hold back businesses. It's supposed to help you to move forward. It seeks to help businesses protect themselves from even more damaging consequences in the event premises need to close due to there being further local outbreaks, which, if all of these guidance and measures are put in place, should be avoided. Okay, next slide, please. Final words. This coronavirus pandemic is very real and a serious risk to public health. If we've learned anything from this local lockdown, the risk posed by coronavirus is real. It's still circulating in Aberdeen. It's out there. We can't see it. We've got to assume that people have it, don't have symptoms. Don't underestimate the virus. Remain on guard. Remember, extreme caution is essential. Everyone has to play their part to control the spread of this virus in Aberdeen. Aberdeen City Council would ask all hospitality premises to focus on complying with the new legal requirements and implementing these new statutory guidance measures. By implementing and following the rules, premises should be able to operate safely and help stop the spread of this virus in Aberdeen. We need to work together, every one of us, to move forward and keep ourselves safe and open up Aberdeen and go back to a more normal way of life. Next slide, please. And lastly, thank you for listening and thank you for your patience. Okay.
I think thank you goes to you, Alison. I think that was definitely a marathon, but you were very thorough and covered an awful lot of ground there. We've obviously run out of time in terms of really being able to answer any amount of questions, but there was a couple that people were asking, obviously, if there's going to be slides that you've given today, Alison, available, and the answer to that is yes. It will be uploaded this week onto our website along with the presentation today. A couple of questions maybe for Vicky, just to give Alison time to catch her breath. There was obviously questions about will there be a police presence in the city centre when the bars open on Wednesday, and will there be a financial penalty for premises not complying with the guidelines?
Hi, yeah, thanks for the question. Let me just turn down my other thing there. Yeah, first of all, yes, on Wednesday we will have a police presence as we normally do in the city centre, and specifically on Wednesday, obviously, just to help, again, just to support the licensed premises from opening. Obviously, at the moment, we're not clear as to how many premises will be opening. We'll be liaising with them over the next few days to see how many we're going to have. But yeah, we'll definitely be there over the next few days, and certainly at the weekend we'll have our usual weekend policing plan in place, where you'll see the vans, etc., out and about. In relation to your second question, in relation to financial penalties, as I said earlier in my opening piece, it was in relation to enforcement will always be our last resort, and we know it's not new guidance, as Alison said, it's been out there for months, but we're just reopening, and we'll certainly work with you, and we certainly won't be closing down pubs or issuing any tickets unless it's as a last resort, and there's no adherence for the guidelines. So you'll have our full support as much as we can up to that point.
Okay, Vicky, that probably follows on nicely, because obviously people are aware of the statutory compliance with the queuing. If premises are struggling to potentially disperse a group of people who seem to be persisting in standing beside their premises, can they call on you?
Yes, definitely. I mean, as it's spoken about before, it is the licensed premises responsibility to deal with the queuing management in place, and obviously have a system in place to try and mitigate that. However, should you be struggling or your staff are getting torrents of abuse from customers, then that's totally unacceptable. And yes, please give us a call and we will be there to support you and to engage with those that are causing you issues.
Okay, that's super. I think that'll be reassuring to the trade.
Yep.
Alison, if I could just ask you a question. Obviously, environmental health officers are meeting with people on site in some cases, and some they will be contacting by phone. If they haven't either had a phone call or a visit, can they still open on Wednesday? You're on silent.
Sorry about that.
That's okay.
The first time for that. Yep. Yes, there's nothing to, yes, they can reopen, the answer to that question. There's nothing to stop them legally from reopening once the lockdown's lifted on Wednesday. It only be premises that we have already been dealing with that'll know, because we'll be telling them you can't quite open yet because you haven't got all the controls in place. If you haven't been contacted, it's because we haven't got round to you yet, because there's massive amounts of work to do, and there will be premises that fall off the list before Wednesday, and we can't get round everybody. So please bear with us. Don't panic if you haven't been contacted. Please fill your details in on the business information on our website so we can get back in touch with you to make an appointment to come and see you, and just think about the measures that you've got in place and try and have them in place before reopening. If you haven't got them, give yourself a bit more time. But no, there's nothing to stop people opening on Wednesday. Can I just come in? I've got a question here I think is quite... So just to clarify, I think somebody thinks that... So one of the questions here is, so regardless of your size, you can only have 8 people from 3 households in any pub or restaurant. No, that's not what it means. It means that you can only have 8 people from 3 households in any table in any group in your restaurant. And if your restaurant fits 100, then you can have a lot more. Some premises, possibly the size of them, is that you can only have about 8 people if you've got a really, really small premises and you've only got a few tables and it's really more a takeaway. But no, it's the 8 people. You can only have 8 people from 3 households in any one group in a premises. So I hope that clarifies that particular side of things.
Yeah, no, that's helpful, Alison. Thank you. There's another question for you, Alison. I think I'll make this the final one. We will be doing an FAQ for people, and hopefully if you've given us your email address, you'll get a direct response. But there was one sort of final question that I think might be helpful. People are asking, will they get any sort of certificate or email confirming that they're compliant and that they've had a visit or assessment with environmental health?
We will try to get back to businesses if they've got any bits and pieces we need to get them to do, but there may be businesses that are contacted by our colleagues and other local authorities, and they won't be in a position to get back to them. So no.
There won't be any certificates.
No, if they need that for whatever reason, they can get in touch with us to discuss that. If they need it for insurance purposes or what have you, we can discuss that individually with businesses. But I would say no, given the constraints and time, trying to get everybody open and to prevent any delays in getting people open, I would say that you're unlikely to be you won't be getting a certificate or any email unless we've said we'll email you back with bits and pieces that you need to do. And you need more information on. I hope that answers that.
Yes, it does, Alison. Yeah. Thank you. I'd just like to obviously thank all the presenters today, Richard, Vicky, Simon, and of course Alison, who, you know, not taking anything away from anybody else's contribution, but I think probably had the biggest chunk of work to do. And again, you know, just the work that has been undertaken by our protective services in the city, along with partners, has been huge. And you know, as I say, I'd like to thank all of you on behalf of the administration and the council elected member base, I would suggest, for all the efforts you've gone to. You haven't left a stone unturned, and you've worked long hours, because I've spoken to many of you at that time, to get us to where we are today. So thank you for that. But I suppose my message is to the premises, and you know, I know that there's a lot of information to take in today, but as Alison said, a lot of it you'll probably have in place. And I think sometimes it's not putting the measures in place that will tax you, but I think it's the constant vigilance that you'll need to demonstrate while you're open every minute of the day. Because, you know, when you have different patrons coming in, they may not be as compliant as you'd like, and having your staff well trained on how to deal with this is going to be essential. None of us want to be where we were before, and that's a lockdown, and I don't believe any of you do either. I think we have an opportunity here to be exemplar and to show other cities around Scotland and the UK how we can come back from this, and I truly believe we will. But that's if we work together. We've had the offer from all our public sector partners, you know, in particular environmental health. If you're not sure, don't guess. Get in touch, and we will do everything we can to support a successful reopening, whether your premises is little or large. You know, we're there for you, we're there to support you, because we want our city to be successful. You know, I think people were maybe overwhelmed and didn't expect the level of patrons the last time round. We've learned our lessons. Let's show we've learned our lessons, and let's show that Aberdeen has made it forward, and we're not going to look back, we're only going to look forward. So, you know, between all of us, I think the real determination that we have to make this successful, I think we will do it. So we've got our opening date for Wednesday. As Alison said, some of you may not open on Wednesday, but whenever you do open, I wish you all the luck, because, you know, I hate to say part of it is luck, because we don't know who's got COVID. We've got a silent disease that's not a visual in some cases. You know, even the person who's carrying it might not know. So we could be unfortunate. And, you know, Chris Littlejohn himself said that Aberdeen was unlucky to have landed with this. But let's make sure we take all the precautions that we can not to make it, I suppose, happen again. And let's hope our patrons also play the game, and we'll move forward together. So thank you all for attending today. As I said, the seminar or the webinar and the questions will be put online, as will a copy of the slides. You saw a list of web addresses from Alison on where you can get help. So hopefully they'll be useful to you. But anybody needs anything, contact Environmental Health. They're here to assist you. They're here to get it right. Let's do our duty, protect our city, and put it back, the reputation back in place. Thank you all, and I'll say good evening almost. Thank you.
Thanks, everybody.
Thank you. Thanks, everyone.